All right, welcome back. We are here with Tamala Jones. Joining our conversation now is neurobiologist and brain expert, Dr. Kristen Willeumier. We are back talking about brain aneurysm, something Tamala experienced when she was just 23 years old, drove off to work, went about your day. And Dr. Chris, you say that is really rare, like she shouldn't be sitting at this table with us now.
I was very surprised. I was also surprised that she went to work knowing that half of the side of her body was stiff and she couldn't move.
So what is a brain aneurysm?
So what is an aneurysm? So an aneurysm is a weakening of the lining of the blood vessel wall, and what ends up happening is this pocket starts to form, a little balloon in this weakened part of the artery in the brain, and it fills up with blood. And ultimately, if there's a lot of pressure, as would happen in her case, it will rupture. So many people have cerebral aneurysms and they don't know it.
Okay.
What are the major causes of brain aneurysms?
That's a great question. So there's many risk factors. So we think about things that really weaken the blood vessel lining. So smoking is a risk factor. Hypertension, so having high blood pressure, that pressure could do it. Atherosclerosis.
Which is, what is that?
So fatty diet, so having a lot of fat and cholesterol, that makes the arteries hard.
So does that mean if you have high cholesterol, you could get an aneurysm?
High cholesterol is a very big risk factor. Okay. Age is a risk factor for people who are 40. I mean, she's so young, but she had a hereditary
So
issue.
it is hereditary.
So if you have a first-degree relative, if you have one or two people in your family that have had cerebral aneurysms, you should get checked out. And what that means is you could go in and get a CT or an MRI with a contrast that'll show the blood vessels, and just as a preventative to see if you have them. And then if you have them, you can do the lifestyle modifications that you've talked about, having a good diet, not smoking, not taking in alcohol. I mean, I know it sounds so simple.
Not going to Bed Bath & Beyond right after you
Getting her sleep,
right?
getting her sleep, that's really important.
So what are the chances of her having another one?
So the statistic is 1 out of every 5 people who've had a cerebral aneurysm could have another. So she just has to be very sort of cautious, and I'm sure your doctors talk to you about that. And so every 5 to 10 years, you can go in and get screened again.
So you had mentioned that there was a family member who had 13 different ones.
After giving birth to a set of twins.
So it brings the question to my mind, can you have different size brain, like heart attacks or strokes? You can have minor ones and massive ones. Is it the same way with an aneurysm, or once that blood vessel wall is penetrated, it doesn't matter, all the floodgates are open?
Well, aneurysms come in different sizes and they're in different locations. So you could have very small ones and be asymptomatic your whole life and never even know you have it. So many cerebral aneurysms can be detected unknowingly. So somebody goes in to see their doctor for some other reason and happens to get an x-ray and the aneurysm shows itself. So, but in her case, she had some pretty extreme symptoms, which would really, in my mind, say call 911.
Sure.
Right.
What would you say, Tamala, for people who are out there who may think that their family member has, you know, what do you say, one generation away, Dr. Chris?
Yeah, well, a family member, right? A mom,
even
a dad, brother, sister, but even aunts, uncles. So 1 or 2 family members that you know have had a cerebral aneurysm.
What would you want them to know?
Well, pay attention to, you know, them saying if they have headaches consistently, like that's like the biggest sign. And they're excruciating. They're not just a little tiny headache. They are the most painful headache you've ever experienced in your life.
And they don't go away?
No, it gets worse. So I would say past 2 days and it's still going, go. I waited 2 weeks. I didn't know what was
You were
going
having
on.
severe headaches, progressively worse for 2 weeks straight.
Yes.
Did you tell anybody, and that you just...
I just self-medicated, you know? Like at 23, you're like, sinus problems, let me take sinus, maybe it's the pressure, maybe it's migraine, that's not working.
Did you tell your mom or dad, or, you know, have headaches? And
my mom thought it was sinus because we also have that as in our family, a little hereditary thing. We all get sinus infections, so she thought maybe I had one. She was like, maybe you need to get some antibiotics. Like, that was the thing. And I'm gonna go to the doctor after work. And during those days, I was my pure Jamaican blood. I had 10 jobs at one time, man. Over here, over there, back over here. I just never rested.
Is there permanent damage from something like this?
It depends on where the aneurysm is in the brain. So if it happens in a speech center or a language center, you could have more deficits. Or if it takes time for you to get to the hospital after it's ruptured, you could have other neurological complications, cognitive issues. So Tamala has come out pretty much unscathed. It's pretty.
Unfortunate.
Should you take like an aspirin when you have, like you would for if you thought you were having a heart attack or a
You
stroke?
can, yeah, you can, to kind of thin out the blood. I mean, that's one.
That was the
Preventative.
only pill I did not take. Was an aspirin. I took Tylenol, Advil,
Everything but an
Motrin,
aspirin.
but an aspirin.
And in her case, she had that extreme explosive headache. If you have that, you should go seek medical attention immediately, because that really is indicative of a potential rupture.